Hey, welcome back. Or if you're new here, so glad you found this video, because today we're talking about something that millions of people deal with every single night, but almost nobody brings up at the dinner table. We're talking about nocturia, which is just the medical word for waking up at night to use the bathroom. And if you're here, I'm guessing this is something you know way too well. Maybe you're up once a night, maybe 3 or 4 times, maybe your bladder has basically become your alarm clock at this point, and not a very friendly one. You finally fall asleep, and bam, there it is. That urge, that pressure, and off you go to the bathroom, again. And then you lie back down, stare at the ceiling, and think, why does this keep happening to me? Is this just aging? Is this normal? Am I stuck with this forever? Well, I have really good news for you today. You are not stuck with it. And it is not just aging. There are real practical things you can start doing today, tonight even, that can make a dramatic difference. So, stick with me, because this video is going to walk you through all of it. But really quick before we dive in, if you're new here, welcome. This channel is all about giving you honest, practical health information that actually helps you make better decisions for yourself and your family. We are on a mission to reach 1,000 subscribers, and every single person who joins this community genuinely matters to us. So, if you find today's video helpful, please hit that subscribe button and ring the notification bell. It costs you nothing, and it means the absolute world to us. All right, let's get into it. Relatable story. Let me paint a picture. Imagine it's 2 a.m. You've had a long day, you finally fell asleep around 11, and now your bladder is calling. You drag yourself out of bed, shuffle to the bathroom in the dark, trying not to wake your partner. You do your thing, come back, and lie down. 20 minutes later, you're finally drifting off again. And then 4 a.m. hits. This is the life of someone dealing with nocturia. And the sleep deprivation alone, the fragmented, interrupted sleep, can affect your mood, your memory, your heart health, your immune system. This isn't just annoying. It actually matters for your long-term health. But here's what gives me hope. Most cases of nocturia are fixable, and most people have never been given the real information they need. So let's change that right now. Section 2. What is nocturia and why does it happen? Understanding nocturia, the real why. Okay, so first, what exactly is nocturia? Waking up one or more times during the night to urinate. Just one time. That's technically nocturia. Obviously, the more times it happens, the more disruptive it is. Now, here's something super important that most people don't realize. Nocturia is a symptom, not a disease. It's your body telling you something is going on, and that something could be coming from a lot of different places. Your kidneys, your heart, your hormones, your sleep, your habits, your bladder, your medications. The list goes on. This is why there's no magic single fix, because there's no single cause. But that's also why this video is going to be so valuable. Because we're going to go through all the major causes and help you figure out which ones actually apply to you. How the bladder works. Let me give you a really quick, friendly bladder tutorial, because understanding how it's supposed to work helps you understand why it sometimes doesn't. Your bladder is basically a muscle, a hollow, stretchy muscle. When it's empty, it's about the size of a small pear. When it's full, it expands to about the size of a grapefruit. Pretty impressive, right? As your bladder fills up throughout the day, it sends gentle signals to your brain. Hey, getting a little full here. Your brain goes, cool, noted. We'll deal with that when the time is right. And you have conscious control. You can say, not right now, bladder. I'm in a meeting. At night, though, your body is supposed to do something amazing. It releases a hormone called ADH, antidiuretic hormone, also called vasopressin, which tells your kidneys to slow way down on making urine overnight. So ideally, you should produce much less urine while you sleep than while you're awake. Your bladder stays more relaxed, and you sleep through the night. That's the plan. Now, here's what goes wrong. The main breakdown points. Reason number 1. Your kidneys aren't getting the memo. In some people, especially as they get older, the body produces less ADH at night, or the kidneys become less responsive to it. The result? Your kidneys keep making urine at the same pace 24/7, which means your bladder fills up just as fast at night as it does during the day, and wakes you up. This is called nocturnal polyuria. Fancy term, simple concept. Your kidneys are making too much urine at night. Reason number 2, your bladder is smaller or more irritable than it should be. This is different from the kidney issue. Here, the problem is that your bladder's storage capacity is reduced, either because it's physically smaller than ideal or because it's overactive and sending false alarm signals. We call this an overactive bladder, or OAB. It basically throws a tantrum and says, "I need to go right now," and your brain can't always override that signal. Reason number 3, sleep disorders. Here's one that shocks most people. Sleep apnea, where you stop breathing briefly during sleep, can directly cause nocturia. How? When you stop breathing, oxygen drops, your heart works harder, and this sends signals that actually increase urine production. People with sleep apnea can wake up to pee multiple times a night, and they don't even know apnea is the cause. Reason number 4, medical conditions. Several health conditions can contribute to nocturia. Diabetes, high blood sugar causes the kidneys to flush excess glucose. Heart failure, fluid builds up in the legs during the day and gets reabsorbed when you lie flat at night. Kidney disease, high blood pressure, and even anxiety and depression. These are all treatable, but you need to know they're there. Reason number 5, habits and lifestyle. And then there's the stuff we do that makes it worse. Drinking too much late in the evening, especially caffeine or alcohol. Not elevating legs during the day if you have swelling. Eating a salty dinner. Poor sleep hygiene. All of this plays a role. And this is actually the most actionable category because you control it completely. Section 3. Lifestyle changes that actually work, the lifestyle fixes. Small changes, big results. Fluid management, the #1 most impactful change. All right, this is where we get into the practical stuff. And I want to start with what I genuinely believe is the single most impactful change most people can make. How and when you drink fluids. Now, I want to be really clear here. I am not telling you to drink less water overall. Dehydration is bad. Your body needs fluids. What I'm saying is, the timing of when you drink matters enormously. Here's the strategy that works for most people. Drink most of your fluids earlier in the day, morning and early afternoon. After 6 p.m., start tapering off your fluid intake. After 8 p.m., try to keep it to small sips, just enough to stay comfortable. Try not to drink anything in the 2 hours before bed. I know what you're thinking, but I'm thirsty at night. That's actually really common, and we'll talk about why that happens and how to manage it. Sometimes it's a habit, sometimes it's medication, sometimes it's a dry environment. But the goal is to shift your fluid intake earlier so your kidneys are doing most of their work while you're awake. Aim for 6 to 8 cups of water a day and just front load it, most of it by 5 or 6 p.m. Caffeine and alcohol. Let's talk about the 2 beverages that are basically kryptonite for your bladder at night. Caffeine is a diuretic, meaning it tells your kidneys to produce more urine. And it's also a bladder irritant, meaning it can directly make your bladder more sensitive and reactive. Coffee, tea, soda, energy drinks, even chocolate, all have caffeine. Now, I'm not saying you need to give up your morning coffee. Not at all. But if you're having caffeine after 2 or 3 p.m., that could absolutely be affecting your nighttime bladder situation. Alcohol is even trickier, the one that slows urine production at night. So, when you drink alcohol in the evening, you're essentially switching off your body's natural nighttime urine reduction system. And then you wonder why you're up 3 times before morning. Sodium and diet. This one surprises a lot of people. High sodium intake causes your body to retain water and then flush it out, often at night. That salty dinner, those chips, the restaurant meal loaded with sodium, it can all come back to haunt you at 2 a.m. Try to reduce your sodium intake. Aim for less than 2,300 millimeters of sodium per day. That's the general recommendation. leg elevation, and afternoon activity. Here's one that almost nobody talks about, but it can make a huge difference, especially if you have any swelling in your legs or ankles. When you sit or stand all day, fluid accumulates in your lower legs and feet. Then when you lie down flat at night, that fluid gets reabsorbed into your bloodstream, goes to your kidneys, and gets processed as urine, which means your bladder fills up and wakes you up. The fix? In the afternoon, say 3 to 5 p.m., lie down for 30 to 60 minutes with your legs elevated above your heart. This lets that fluid drain back into circulation while you're still awake, so your kidneys process it before bedtime. Seriously, try this for a week. Some people see dramatic improvement. Evening routine overhaul. Your evening routine is your bladder's best friend, or worst enemy. Here's what a bladder-friendly evening looks like. Light, low-sodium dinner. No caffeine after 2 p.m. Leg elevation in the afternoon. Fluid intake wrapping up by 7 or 8 p.m. A relaxing wind down. Dim lights, no screens, calm activity. A trip to the bathroom right before bed. Not just when you feel like it, but deliberately as part of your routine. That last trip to the bathroom is important. Empty your bladder completely before sleep. Lean forward a bit when you go to make sure you've emptied as fully as possible. This gives you a longer window before the first wake-up. Section 4. Bladder retraining and behavioral therapy. Bladder retraining, teaching your bladder who's boss. Okay, here's where things get really interesting. Because your bladder, believe it or not, can be trained. Just like you can train a muscle at the gym, you can actually retrain your bladder to hold more and respond less urgently. And this has been shown in studies to help even when the issue is at night. Why bladder retraining works. Here's the key insight. Your bladder and your brain have a relationship. And in people with overactive bladder or nocturia, that relationship has become a little unhealthy. Your bladder has trained your brain to respond to every little signal, every small fill, every slight pressure with, "You need to go now." Bladder retraining is about reclaiming your brain's authority. It's about teaching your brain to say, "Yes, I hear you, bladder, but we're going to wait a little." And over time, usually 4 to 8 weeks, this can genuinely change the threshold at which your bladder sends those signals. Daytime retraining exercises. Now, bladder retraining is primarily a daytime activity, but the nighttime benefits follow. Here's how it works during the day. Instead of going to the bathroom the instant you feel the urge, you practice waiting, just a little. Start with 5 minutes, then work up to 10, 15, 20 minutes. When the urge hits, try these techniques. Stop what you're doing and stand still. Don't rush to the bathroom. That actually makes urgency worse. Do a few quick pelvic floor contractions. Squeeze and release, squeeze and release. This actually signals the bladder to calm down. Take slow, deep breaths. Activate your parasympathetic nervous system. Once the urge subsides a little, then walk calmly to the bathroom. Pelvic floor exercises, the real deal. We have to talk about pelvic floor muscles, and I want to address something. This is not just for women. Men have pelvic floor muscles too, and strengthening them can significantly help with bladder control. Your pelvic floor is a hammock of muscles that supports your bladder and helps control urination. When it's weak, which happens for lots of reasons including aging, weight, past surgeries, it can lead to urgency and leakage. The classic exercise is the Kegel. And here's how to do them correctly. First, identify the right muscles. Imagine you're trying to stop urinating midstream. The muscles you squeeze? Those are your pelvic floor muscles. Now, not while actually urinating, just sitting or lying down. Squeeze those muscles, hold for 5 seconds, then fully relax for 5 seconds. That's 1 rep, do 10 reps, 3 times a day. As you get stronger, work up to holding for 10 seconds. Be patient. It takes 6 to 12 weeks to see real results, but research consistently shows that pelvic floor training significantly reduces urgency, frequency, and incontinence. It's one of the most evidence-based interventions we have. Nighttime strategies, a few specific strategies for nighttime. Keep the path to your bathroom safe and easy. A nightlight can prevent falls, and also means you don't have to fully wake up to navigate. If you wake up and feel the urge, try lying still for a few minutes. Sometimes the urge diminishes. Your bladder might have more room than it's letting on. Resist checking your phone. Light tells your brain it's daytime, ruins your melatonin, and makes it much harder to fall back asleep. Some people find that sleeping on their side versus their back can reduce nighttime urgency. Worth experimenting with. Section 5. Medical causes and when to see a doctor. What your doctor needs to know. Here are the main medical conditions associated with nocturia that you'd want to discuss with a doctor. Diabetes, both type 1 and type 2, can cause excessive urination because high blood sugar makes the kidneys filter more. If you haven't had your blood sugar checked recently, please do. Sleep apnea. We touched on this. If you snore heavily or feel exhausted during the day, please get a sleep study. Treating sleep apnea with a CPAP can literally eliminate nocturia in some people. It's that significant. Heart failure or venous insufficiency. When the heart isn't pumping efficiently, fluid backs up in the body. Treating the heart condition often resolves the nocturia. Urinary tract infections. A UTI can cause urgency and frequency. If nocturia came on suddenly, an infection is worth ruling out. Prostate issues in men. An enlarged prostate, benign prostatic hyperplasia or BPH, is one of the most common causes of nocturia in men. The prostate surrounds the urethra, and when it enlarges, it can obstruct urine flow and cause incomplete emptying, which means more frequent trips. Interstitial cystitis, a chronic bladder condition that can cause severe urgency and frequency, including at night. Medications. This is huge and often overlooked. Diuretics, water pills, lithium, certain blood pressure medications, SSRIs, and others can all contribute to nocturia. How to talk to your doctor. I want to give you some tools for making the most of your doctor's appointment. Here's how to advocate for yourself. Bring a bladder diary, 3 to 7 days of tracking when you go, how urgently and how much. This is gold for any physician. List your medications and supplements, all of them. Let the doctor look for bladder-affecting culprits. Mention your sleep quality and ask specifically about sleep apnea. Ask about nocturnal polyuria testing. A 24-hour urine collection can determine how much of your urine production is happening at night versus day. If you have leg swelling, mention it explicitly. Don't accept just aging as an answer. Ask, what are all the possible causes and which ones can we test for? Section 6. Sleep quality and the bladder-sleep connection. The sleep connection. It goes both ways. Let's talk about what good sleep actually looks like and how it helps your bladder. During deep sleep, especially slow-wave sleep, your body releases the most ADH, the hormone that slows urine production. If you're not getting enough deep sleep, you get less ADH, and your kidneys don't slow down as much at night. So, improving sleep quality actually helps the hormonal side of nocturia. Here are the sleep hygiene basics. I know you may have heard some of these, but they genuinely matter. Keep a consistent sleep schedule. Same time to bed, same time to wake, even on weekends. Make your room dark and cool. Around 65 to 68 degrees Fahrenheit is ideal for most people. No screens for at least 30 minutes before bed. The blue light suppresses melatonin. Avoid large meals within 2 to 3 hours of bedtime. If you can't fall back asleep after a bathroom trip in about 20 minutes, get up, go to another room, do something calm, and return when sleepy. Don't lie there anxious. Anxiety and the bladder. This one deserves its own moment. Anxiety is a bladder's worst enemy. The sympathetic nervous system, your fight or flight system, increases bladder sensitivity and urgency. If you're going to bed anxious, worried, stressed, or lying there in a heightened mental state, your bladder is going to be more reactive than it would be if you were calm. I'm not saying nocturia is all in your head. Absolutely not. But managing stress and anxiety is a completely legitimate part of managing nocturia. And it's an area where things like meditation, progressive muscle relaxation, journaling, and therapy can genuinely help. A 10-minute relaxation practice before bed, body scan, deep breathing, or a guided meditation can calm your nervous system and reduce bladder reactivity overnight. Try it for 2 weeks. Melatonin and other supplements. A quick word on supplements. Melatonin is often recommended for sleep, and there's actually some evidence that it may also have a direct positive effect on bladder function. The dose matters. 0.5 to 1 mg is actually more effective for sleep than higher doses, which can cause grogginess. Magnesium glycinate is another supplement worth mentioning. It helps with muscle relaxation, including bladder muscle, and can improve sleep quality. Many people are deficient. Pumpkin seed extract has some interesting evidence for bladder control, particularly in men and women with OAB. Not a miracle cure, but worth discussing with your doctor. Always run supplements by your doctor or pharmacist, especially if you take other medications. Section 7. Putting it all together. Your action plan, your personalized action plan. Okay, we've covered a lot of ground. I want to take the last part of this video to help you pull it all together into something you can actually use. Because information without action is just information. The quick win list. Start tonight. 52 words. These are things you can literally implement today and tonight. Have your last significant drink 2 to 3 hours before bed. Cut out caffeine after 2 p.m. Take a dedicated bathroom trip right before you get into bed. Put a nightlight in the bathroom so you don't have to turn on bright lights. Make sure your bedroom is dark, cool, and quiet. Start doing pelvic floor exercises today, 10 reps, 3 times. The 1-week plan over your first week, add these. Keep a bladder diary for 3 to 7 days. Track every bathroom trip, urgency level, 1 to 5, and approximate volume. Move most of your fluid intake before 6 p.m. See how this alone affects you. Try afternoon leg elevation for 30 to 45 minutes. Lower your evening sodium. Skip the salty snacks after dinner. If you drink alcohol, try eliminating it for a week and observe what happens. The 1-month plan. Over your first month, continue bladder diary and start working on daytime bladder retraining, gradually extending the time between bathroom trips. Establish a consistent bedtime and wake time. Add a pre-bed relaxation practice. Make a doctor's appointment if symptoms are severe, long-standing, or involve pain. Bring your bladder diary to that appointment. Ask specifically about sleep apnea, medications, and nocturnal polyuria testing. And through all of this, be patient with yourself. This is a process. Some people see improvement in days. For others, it takes weeks or months. But the effort is absolutely worth it because quality sleep genuinely changes your quality of life. Section 8. Closing. Closing. You've got this. Summary. All right, let's do a quick recap of the big ideas we covered today. Number 1. Nocturia is a symptom, not a sentence. It has real causes and real solutions. Number 2. The most common causes are nocturnal polyuria, too much urine at night, overactive bladder, sleep apnea, medications, and lifestyle factors, and you can address most of these. Number 3. Fluid timing is your biggest lever. Front-load your fluids, taper in the evening. Number 4. Cut caffeine after 2 p.m. and consider eliminating evening alcohol. Number 5. Bladder retraining and pelvic floor exercises are genuinely effective. Give them 4 to 8 weeks. Number 6. Sleep quality and nocturia have a two-way relationship. Improving one helps the other. Number 7. See a doctor if symptoms are significant. Bring a bladder diary, ask about sleep apnea, and don't accept just aging as an answer. I hope this video gave you a sense of hope, because I really believe in the power of this stuff. So many people who struggle with nocturia have genuinely transformed their sleep just by making some of these changes. You don't have to just accept fragmented sleep. You don't have to shuffle to the bathroom 3 times a night and feel groggy and exhausted every day. There are real answers. You deserve real answers. If this was helpful, please give it a thumbs up. It really does help more people find this video. And if you have questions, leave them in the comments. I read every single one and I love hearing about your experiences. I'll see you in the next video. Take care of yourself and get some good sleep tonight. You've earned it.